Today's video will be covering Alzheimer's disease, so covering causes, symptoms, diagnosis and treatment. So let's begin. So Alzheimer's disease is a brain disorder which gets worse over time. So this has changes in the brain which leads to deposit of certain proteins. So Alzheimer's disease causes the brain to shrink and the brain cells to eventually die. This is the most common cause of dementia, which is a gradual decline in memory, thinking, behaviour and social skills. These changes that you get, they affect our person's ability to function. So it's a chronic ongoing condition and the symptoms are gradual and it's known as a degenerative. So there's no cure, but there are various risk factors, right? So the early signs of disease include forgetting recent events or conversations. So over time this progresses to serious memory problems and the loss of ability to perform everyday tasks. So if you take medicines, this can improve or slow the progression of symptoms. And as I said before, there's no cure. So if you have advanced stages, you can have severe loss of brain function, which can cause dehydration, malnutrition or infection, and this can result eventually in death. So the exact causes of Alzheimer's aren't fully understood, but to sum it up briefly, brain proteins fail to function as usual. So this disrupts neurons and triggers a series of events. This leads to neuron damages, and then this loses the connection, so the neurons lose connections to each other and eventually die. So Alzheimer's disease is believed to be caused by a combination of genetic, lifestyle and environmental factors which affect the brain over time. Interestingly, the development of disease begins years before the first symptoms. The damage the most often starts in the region of the brain that controls memory. So the loss of neurons spread in a somewhat predictable pattern to other regions of the brain. By the time you have late stage of disease, the brain is shrunk significantly. So the two proteins that are involved in this are called amyloid and tau. So beta-amyloid is a fragment of a larger protein. So when these fragments clump together, they have a toxic effect on neurons and they disrupt communication between brain cells. These clumps then make larger deposits known as amyloid plaques, which include other cellular debris. And also you have the tau proteins, which play a part in the brain's internal supports and transport system, carrying nutrients and other essential materials. So in Alzheimer's disease, tau proteins change shape and organize into structures called neurofibrillary tangles. These tangles disrupt the transport system and cause damage to cells. Early signs of Alzheimer's disease include memory loss. You have difficulty remembering recent events or conversations. When the memory gets worse and other symptoms develop as the disease progresses. So, with people with Alzheimer's can repeat statements and questions over and over. They can forget conversations, appointments, and events. Misplaced items, often put them in places that don't make sense. Get lost in places they used to know well. Eventually, they end up forgetting the names of family members' everyday objects, and they have trouble finding the right words for objects, expressing thoughts, or taking part in conversations. So they end up having difficulty concentrating and thinking, especially about abstract concepts such as numbers. They also have decline in the ability to make sensible decisions and judgments in everyday situations. So as days go on, they might find it harder to respond to everyday problems. So they might not know how to handle food boiling on the stove or decisions when driving. They can have trouble planning and cooking a meal. And eventually, once you get to advanced stage, they forget how to do basic tasks such as dressing and bathing. Changes of personality can also occur, and that includes depression, loss of interest in activities, withdrawal, mood swings, distrust in others, anger, aggression, changes in sleeping habits, wandering and loss of inhibitions, and delusions as well. For diagnosis, you have blood and imaging tests so you can rule out other potential causes of the symptoms. So you can also have biomarker tests, which can detect the presence of plaques and tangles. And these include specific types of PET scans and tests that measure amyloid and tau proteins in the fluid, part of the blood and cerebrospinal fluid. With regards to your physical and neurological exam, this will test your reflexes, muscle tone and strength, the ability to get up from a chair, walk across the room, sense of sight and hearing, coordination and balance. Blood tests can also be used to rule out other potential causes of memory loss confusion, such as thyroid disorder or vitamin levels that are too low. Blood tests can also measure levels of beta-amyloid protein and tau protein, but these aren't widely available and very limited. You can also have mental status and neuropsychological testing, so this will assess your memory and other thinking skills. You also have brain images, which are used to pinpoint visible changes to other conditions other than Alzheimer's, which can include strokes, trauma, or tumours. So images of brain starts to include MRIs and CT scans. So I mentioned earlier about a PET scan. So that's known as a positron emission tomography, and this can capture images of the disease process. So how that works is that a low-level radioactive tracer is injected into the blood to reveal a particular feature in the brain. So this includes fluorodeoxyglucose PET imaging, which shows areas of the brain in which nutrients are poorly metabolized. And you can find patterns in the areas of low metabolism, which can help distinguish between Alzheimer's and other types of dementia. You have amyloid PET imaging, which can measure the burden of amyloid deposits in the brain. And you can have tau PET imaging, which measures the tangles in the brain. Both these ones are usually used in reset settings. Finally, for Alzheimer's, although there's no cure, there are treatments available. So these involve cholinesterase inhibitors. These medicines work by boosting levels of cell-to-cell communication. So they preserve a chemical messenger that is depleted in the brain by Alzheimer's disease. So these are usually the first medicines that are given, and they can improve symptoms related to behaviour such as agitation or depression. So these are taken orally or delivered through a patch on the skin. So usually the ones that are prescribed are the ones known as donepezil, galantamine, and rivastigmine, transdermal patch. They do have side effects, however, which include diarrhea, nausea, loss of appetite, so in people with certain heart disorders, serious side effects can include an irregular heartbeat. There's also something called memantine. This medicine works in another brain cell communication network and slows the progression of symptoms of moderate to severe Alzheimer's disease. It's sometimes used in combination with cholinesterase inhibitor. It has relatively rare side effects, but these include dizziness and confusion. So that's just an overview of Alzheimer's disease. So I hope you had fun watching this video. Please give it a like and subscribe if you're new to this channel. And looking for the next one. So the next video will probably be on eczema and psoriasis. Thank you very much for tuning in. Right, thank you. Bye bye.